Plastic Surgery by Patty Watson. Sir Harold Gillies was the first person during World War I to actually start perfecting plastic surgery. After he graduated from medical school, he volunteered for the American Red Cross during World War I, and he was a general surgeon at that point in time. He started working with a dentist doing facial reconstruction and found that he was really excited about this type of work. He did so well that he was sent to the Cambridge Military Hospital on a special duty of just doing plastic surgery on military men's face after the war. He replaced bone for bone and cartilage for cartilage and skin for skin. He believed that he needed to restore the function of the face and the tissue. A public survey was done on plastic surgery, and of the 213 people surveyed, 65% of them were female, 38% between the ages of 46 and 65 years old. And what this survey showed was that people don't have a very good understanding of plastic surgery and who you should have do a particular type of surgery. Like, they were asked if they had skin cancer, who they would have to remove the skin cancer. And they wanted a dermatologist to remove it and a plastic surgeon to reconstruct it, making this a two-step process, whereas a plastic surgeon could have done the whole thing, making it one. Hand surgery is also very common for plastic surgeons, but when people were asked who they would have do a hand surgery, they referred to an orthopedic surgeon. And I think that the media influences people's perspective of this due to TV shows such as Nip Tuck. The top 5 reconstructive procedures is tumor removal by a landslide. In 2011, there was 4,200,000 tumor removals. Next came a laceration repair of 303,000, followed by maxillofacial surgery of 195,000, and scar revision of 175,000, followed by hand surgery at 120,000. That's the top 5 reconstructive procedures. As far as cosmetic procedures, there's lifts, tucks, fillers, resurfacing, dermabrasions, peels, and hair replacement. The difference between a surgical procedure and a cosmetic procedure is the cosmetic procedure is typically done in the doctor's office, and it is very non-invasive, whereas a surgical procedure is pretty invasive. As far as ethnicity and who requests plastic surgery to be done, Caucasians are the number one, and some type of breast surgery is the number one surgery that a Caucasian would request, whether it be augmentation, reduction, or enhancing. Hispanics come in second, and their number one request is liposuction, followed by African Americans, who typically request liposuction as well, and Asian Americans request nose reshaping. And 51% of all cosmetic patients are repeat customers. As far as women versus men, there was 13,310,313 cosmetic procedures, and of that 13 million, 12,116,310 were women, making less than 1 million men. So women does consume most of the plastic surgeries. And of that 1,374,720 were on women, 204,359 surgical procedures were on men. So there's definitely a lot more cosmetic procedures than there are surgical procedures. As far as women as a whole, the number one surgical procedure is breast augmentation, followed by nose reshaping. And as you can see in this picture, she has a crook here in her nose, and then afterwards it's a very straight bridge of her nose. And the third requested surgical procedure is liposuction, followed by eyelid surgery. And in this woman, you can see basically her eyelid comes clear down to her eye, but after they did the surgery, she now has a lid here where she could put shadow on it if she wanted. Followed by the last requested surgical procedure as a tummy tuck. As far as the age of the women who are having cosmetic procedures, the number one age group is 40 to 50-year-old women, and they're having some type of breast augmentation. Followed by 55 and older are having the eyelid surgery or any other facial surgery. The 30 to 39-year-olds come in third, and they're having breast augmentation and Botox. The 20-year-olds, the 20 to 29-year-olds, are having breast augmentation, and the 13 to 19-year-olds are having nose reshaping. I thought the 13 and 19-year-olds might be some type of an acne treatment, so I was a little surprised that it was their nose rather than their face. And then I noticed once we got to be 55 and older, we were no longer as concerned about our breasts, and I don't know whether that's because we've already had them fixed when we were younger, or if it's just not as important to us at that point in time, and our face becomes the focus. When consulting with patients, it's important that a doctor find out the motivation behind why the person wants to have plastic surgery, what their expectations are from the surgery, and if there are any, what the risks are associated with the surgery, and how much anxiety is the patient having regarding the surgery, because not every surgery is going to be successful. If you have a woman with some psychological issues, she may never be happy with the outcome of the surgery. If you have women who have some type of trauma going on in their life, then they may not be happy with the outcome of the surgery either. Empty nesters, bad relationships, all of these can be a result of bad surgical outcomes. Also, you want to watch altering of a family or ethnic trait. Sometimes you don't get support from your family if you go changing a crooked nose that defines who you are. As far as the future, plastic surgery makes you feel good about yourself. All age groups are doing it. Young adults are already inclined to see the body as a canvas for self-expression, as a high percentage of those who have piercings and tattoos attest, and as they come of age, and societal hesitations about altering the body through surgery may over time simply disappear.